can we call you? Mom?
Mom's fine.
Mom's fine, okay. Excellent, excellent. All right.
I love being a mom.
Good. So how's Julie doing now?
I don't know. She just doesn't seem good. She hasn't seemed well for a while.
Yeah, okay. Well, see, Julia was actually, she's a 2-year-old young lady. She previously came in, she's previously healthy. However, now, for the past week, she's kind of been ill. Has been having kind of like this respiratory distress issue. For the past 7 days, she's been coughing. For the past 3 days, she's been having a fever. I believe you said about a week ago, you noted just a dry cough with runny nose, but there were no other symptoms at that point. And she seemed like she was really happy, seemed to be running around like her usual jovial self. But now, she's kind of more quiet and not as energetic. This actually happened last Tuesday. She's also been coughing lately. The cough has been, coming back and forth throughout the night. But you noticed it was a little bit worse last night. And it actually seemed to keep her up, so she didn't get too much sleep last night. So I guess, the grandmother tried a few different remedies as well. They also tried some Tylenol to help, with the patients, with Julia's fever, and to help, with the sore throat. And nothing seemed to really help at that point. And you said over the last 3 days, I guess, the mom's been noticing that the patient's been coughing up this green mucus, and may have been like a little bit of occasional blood, but I guess you're a little squeamish at that point and didn't actually take a good look at it. The mucus has now turned green as well. I think over the last few days, the patient had about 5 wet diapers, and there was like a green colored stool in the diapers as well yesterday. Basically now, I guess just go. Now Julie was born. Was a preemie. She was born 2 weeks early. She was born at 36 weeks due to preeclampsia. She was not intubated at the time and was monitored in the NICU for 2 days. And she has had appropriate weight gain at this point, up until this point. And she had esophageal reflux actually as an infant, and that resolved by the 12th month. One hospitalization did occur at 7 months for wheezing, and she required albuterol at that point, but you haven't used the albuterol, I believe, since then.
Just that one time.
Okay. The patient actually hasn't had any surgeries since being born. And it's just part of the family history. One of the cousins actually has cystic fibrosis, and I think as we said with albuterol, we haven't been using that as well. But cystic fibrosis was the only family history. There are no known allergies for the patient, for Julia, and she has not actually received 18-month vaccinations at this point. Otherwise, her vaccination has been up to date. I'm sorry, I will still continue with the family history. Mother, sister, and brother all had asthma, and the father actually has Crohn's disease, and maternal grandparents both had hypertension and hypercholesterolemia. Paternal grandmother had ulcerative colitis, and the grandfather died from a stroke at the age of 68. They live in a townhome at this point, and they have both cats and dogs, as well as an occasional, mouse in the house. And they have carpeting throughout. So generally, review of systems. Julie's has been a bit more fussy lately. Been sleeping a little bit more. Just going over the head and ENT exam. There's not really been any drainage or pain associated. However, there has been some congestion. She actually hasn't been really, has been kind of a bit fatigued, but there's been also a little bit of a syncope with exertion. And on the respiratory exam, there's been minimal respiratory issues, but more so like wheezing. And it was positive for a wet, productive cough. The patient really hasn't had any diarrhea except for this morning when we noticed the loose green stools. And let's see, she denied any bruising or bleeding like that, and denied any rash. So physical exam, just the vitals this morning. Patient's temp was 38.5, was normal, heart rate 120, respiratory rate was 40. Generally, I guess for most of our physical exam, most of it is within normal limits. Generally, the patient has been resting comfortably. Mom's arms, the mucous membranes have been producing clear nasal discharge. There's no erythema within the oral pharynx, no edema or tots or swelling. Cardio exam, the patient was tachycardic, had normal S1, S2, regular rate and rhythm, no murmurs, rubs, or gallops were noted. In respiratory exam, patient was tachypnic. There was inspiratory crackles on the left lower lobe with occasional inspiratory wheezes heard throughout both lung fields. Let's see, as well, abdominal exam, abdomen was soft, non-distended, non-tender, with normal bowel sounds, with no noted hepatosplenomegaly, or no rashes noted. On labs, CBC, white blood cell count was at 14, H&H was at 12 and 38, and platelets were at 315, and sodium was 135, potassium 3.5, chloride 101, bicarb 26, and BUN was 10, creatinine 0.3, and glucose 112. We haven't done any imaging yet at this point. So, Mom, when you're just looking at Julie at this point, the concern again just be possible, just because of the family history, maybe possible asthma as well. We're also concerned for kids at this age tend to sometimes swallow some things that may be causing that green kind of like infectious type mucus that we see.
You mean like something could be stuck in there?
So that's a possibility. That's definitely a possibility.
Oh, wow.
Kids at 2 years old just happen to pick up a lot of things. We may end up swallowing something, but we can go ahead and try to work with the team to try to see we can make a plan to go ahead and attack that. So, if you have any questions, I guess.